So,
Yes.
February 2, Board of Supervisors special session.
Are we on Renee? Not yet, all right.
We're good.
All right, very good. Welcome. It is Wednesday morning. We'll call this special session of the Board of Supervisors to order. Mr. Grandia.
Keisha Johnner,
Here.
Mark Ramey,
Here.
Steve McCombs.
Here.
Would entertain a motion to approve this morning's agenda, i.e. budget.
I move to approve today's agenda.
A second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
All right, very good. We're in day 3 of budget. Lindsay, welcome back.
Thank you.
Good to see you. This morning is the Kim Dorn show. So you've got a bunch of these, Kim. I mean, you got environmental health, public health, senior nutrition. There's one more, right?
General assistance.
And general assistance. All right.
And
So
then this
Medical
year,
exam.
we have medical examiner to present to you to decide whether you want us to do it this way or whether you want to continue the way that it's been.
all right, very good. So I'll let you start where you want, and then we'll go from there.
All right. Well, let's start with environmental health. And environmental health, for all staffing, for everybody involved, we use a 3% bucket so that you know what's going into it. So
All right.
we just use the 3% bucket. We'll sort out we don't always just do a 3% across the board anymore. It kind of depends on how the performance evaluation goes. And we kind of tinker with that within that 3% bucket. So for environmental, for public health, that's just kind of how we've been doing it.
Okay.
So really the environmental health budget is very, very much the same as last year, with the exception of we did the 3% bucket, and then you'll see that I put in $30,000 for a motor vehicle, in case the truck,
Is that the truck that, yeah, it was,
the
that we've
green
had,
truck?
yeah.
Yeah, it's getting some age on it, it's getting up, it's over 175,000 miles. They've been asking for a different truck for, I don't know, 5 years, but it still continues to work. I put in 30,000 thinking that we would find something used that if we need to, if it becomes something that, you know, is really costly to fix or something. It's not been nickel and diming us to death yet.
Okay.
But we're kind of watching it.
It's not a rust bucket.
It's not a complete rust bucket. It does have some rust problems. The running boards, we had to have them removed, and because they rusted off and there was nowhere to attach them. But the staff has their personal vehicles don't have running boards, so they can hop up in there yet. So it's not. I'm not understanding that the bottom's gonna fall out of the truck any day soon. So 30,000, I don't know is gonna buy much of a truck.
I was gonna say that
Today's marketplace,
Yeah.
that's a stretch.
You might find one with, you know, 100,
$100.
yeah.
Yeah.
I suppose it would. I mean, you have a lease program in public health, right, Kim?
What's that?
You have a lease program in public health.
We do. Our leased vehicles we use them for not in environmental health. We use those in our public health side where the staff is taking medical equipment and
Sure.
that kind of stuff. So I try not to mix that very much because poop and medical equipment don't go well together.
Any way to add a truck to it, and is there efficiency there?
We can look into it. Our leases are up in June, so I need to start finding out what we're gonna do, because that leasing program has worked really, really well for us.
Yeah. So it might be good just to take a look and see
Okay.
if you can do that and add a truck to the lease and
Okay,
And at least that way you get turnover.
yeah,
You're not hanging on to something until it has no value.
yeah, well, and we got this truck, it was used, it was I think it was Jeff's truck before it was our truck.
Oh.
And so we've kind of done the hand-me-down thing, which, it's worked for us.
Sure.
It's all good.
Oh, it's that white one. Was it the white one that you've had before?
The white one came from maintenance.
Oh,
and
okay.
It was.
Never mind, it's okay. I
Yeah,
just,
that one was rough when we got it.
I was thinking it was just that one, but it's
We
not.
paid like 35, we paid the maintenance department $3,500
Yeah.
for it,
It was that little.
and we got a $3,500 truck.
All right.
Yeah,
Jeff,
so,
Can I just put in a plug?
Yeah.
So this isn't not to do leases, but just remember, there's a new GASB that's gonna start taking effect for everything leased that we're gonna have to account for. It doesn't mean it costs any more or less, but leases like copiers, printers, your vehicles, somehow we'll have to track all that for a new GASB into the audit report starting next year. It's been coming for a couple of years, just FYI.
What have we done in the past?
We don't have to include like her leased vehicles. It's noted that she has the lease, but we don't place value to the county or anything on it. So I don't know exactly, it's not in place yet. It's a new,
So you guys haven't been under,
like if we have a lease for
you
a
just,
copier,
you
it
just,
doesn't go on our value, isn't added value to our,
really? It's not a liability?
well, yeah, as an asset or anything
Yeah.
like that.
Okay,
It's noted that we have the
Okay.
the liability,
okay,
the payable,
okay, got it. All right, very good.
somehow.
so
I don't even know what the GASB number is, to tell you the truth.
I'll have to get with you and learn more about that.
We all have to, I just wanted to note here.
That's
Okay.
That's interesting, because I
Because
just,
if they do it with Caterpillar,
Yeah.
with road maintainers, that type of stuff, it's all gonna be the same.
Yeah.
A truck, Caterpillar, a copier.
interesting.
There's lots of folks trying to sell software to help manage
Sure.
whatever the GASB is.
Sure, very good. That's
Sorry to
interesting.
interrupt.
Oh, thank you.
So anything else on environmental, Kim?
I think that's pretty much it, unless there's questions.
With the, are we still seeing volume, I mean, in terms of number of septic inspections and things like that? I mean, staffing wise, are we still good?
Yeah, we're still good staffing wise.
Okay.
Yep. And, yeah, Cameron's been a really good addition to our group. He's very good. Corey taught Bridget well, Bridget taught Cameron well. So it's going very well.
Okay, good.
Well, I see they have, I mean, like year to date, Kim.
Mhm.
So, I mean, I don't know when these numbers were exactly ran, but I mean, they're getting a little bit of overtime. Is that correct then? Or is that just because of when it was ran and we're into January that it was 57? So, which I'm not opposed. I just was wondering if.
Yeah, well, Bridget's on salary, so she should be on track.
Okay.
Except that I think that we had a little hiccup where, somebody got put under the wrong COA number a couple of times.
Okay.
But I think they're okay.
Yeah.
Yeah, Cameron what we try to do for overtime, like if somebody works a little over 40 and they're an hourly employee, if they work over 40, then we give them comp time and I don't let them collect a whole lot of comp time, I only let them get up to 16 hours and then they've gotta use it.
Okay.
So, yeah. Any other questions about
Steve, any
environmental?
questions?
I see you've budgeted for 36% increase in health
Yeah. And health insurance.
costs. Page 2.
Just a second, I'm trying to find it. Ooh. Well, probably what I did with that number was take the year-to-date and divide by wherever we were in the calendar. I think I did that in November. Divide by 5 and take times 12, so that's probably how I got that number.
So it's a cumulative number, is that what I'm hearing, yeah?
It would be
I think
based on
that-
what we've paid so far this
Yeah.
year. So
So maybe a little high, yeah.
Yeah, it might be a little high.
Okay.
But we did build in a significant increase in health insurance, like 10%.
Yeah. Okay.
Any other questions?
I don't have any.
Steve?
No?
All right.
All right.
General assistance.
General assistance.
All right, which number is that?
Yeah. I couldn't find it on my sheet.
Social,
25.
it's 25, yeah, social
Yeah.
services.
Social services?
And you will see that we budgeted a little less than last year. We continue to use the same methods that we have been using since it came under our department, where we, when somebody comes in, we try to link them to other services first and other places that they can have their need met. If somebody comes in for, they need food, we'll try and get them to one of the food shelves first. We don't do food vouchers where we just give them a voucher and they go to the store and pick what they want. We will sit down with them and do and we'll actually order online and have a pickup so that they're actually getting food and not other things. So you'll see that I zeroed out the ambulance. We haven't used that for several years. So,
Okay, yeah, I see. You left the clerical then, because I know that we
Yep.
started billing for taking care of it.
right, and so we bill $25 per interaction.
Mhm.
And, that's one of those deals where sometimes we win, sometimes we lose. If it takes 10 minutes, it takes 10 minutes. If it takes 3 days, it takes 3 days.
What is, Kim, what's the account auditing clerical?
Isn't that what you're,
That's what that is.
Yep.
That's where we bill our $25 per.
Oh, I'm sorry, I was looking at
Isn't
ambulance
that what that
service where
is?
you zeroed out your ambulance. And then.
Yep.
Okay.
Yeah, that's where we bill our time. Per encounter.
it's interesting to look at the numbers in like the food area, even the 2020 and 2021. It wasn't significantly high even though it was COVID.
There's a lot of money out there though for people.
Right.
A lot of overlapping services, which has always been our argument.
Yeah.
And why we changed it. So,
Yeah. So it's, if there's money out there in a different place than this, they're pretty, the gals are really good about saying, this is last resort, folks, so, you go here and you check with this place and.
How easy can we ramp up if we run out of those resources? Because eventually the cash hoard, or what I want to say, the parachute money is gonna end.
Most of the places they refer to are places that are established,
Okay.
so they're not likely to go away because COVID money goes away.
Okay,
The food shelves, there's a lot of food shelves available. The housing money is probably where COVID has been the most flush. The issue there is there's no place to rent, there's no physical houses to rent, so people are struggling with that. So we do have, occasionally we'll have somebody come in and we had somebody this last week that needed help with housing for 1 month because they were just underwater. And so we helped them with that. So, yeah, rent payments. Yeah, you'll see that we haven't really used personal items and clothing for years, but I still put that in there, and like I said, we don't use it if we don't need it. So overall, it's another decrease of I don't know. in the
And I wonder
neighborhood of
if we need to,
5,000.
I was thinking of that, do they give the resources and just even in Knoxville that have, for clothing, I mean, do they give vouchers for that? Is that something, I suppose it could be a specialty item, let's say they couldn't afford their boots of some sort, I mean, and they were gonna, go to work of some sort, you know what I mean? They just didn't have the funding, there would be something, yeah.
We
Okay.
haven't had a request like that.
Okay,
But we still have that $1,000 in there. We would ask them to go to the well first and
Right.
see if there's anything available there.
that's what I was thinking, of probably those clothing vouchers are taking up, a lot of that, why we haven't, seen people
Yeah.
ask, so.
Well, we shouldn't, I mean, to your point, Kim, with all the number of different services available, we should be last resort.
Right.
And this should come down to meet whatever that need is. It's if that capacity ever dries up for some reason, which it doesn't seem like it is. It seems like it's just increasing. More people are forming nonprofits. There are well-like organizations springing up in different ways. So.
Yeah, and I'm not gonna lie, my staff's pretty darn creative sometimes, but they can get things done and I just shake my head and say, that's good.
Yeah,
If we get the need met, that's the goal.
that's good.
With the unavailability of rentable spaces, Kim kind of explained the line item on the utility payments, why there's such a decrease in,
Well, I think that's
and another,
also COVID money.
Yeah.
okay,
That's
Okay.
also COVID money.
okay.
There's just a lot of money out there right now. And eventually it should dry up.
Mm-hmm.
Should.
Should. Yeah.
Yeah, so, but as long as there are other resources out there, we are going to refer them there first and help them to tap into those first.
Okay.
That's the whole goal of the community care coordination that we do.
Yeah, that's right. Good. Very good.
In the future, our numbers may look a lot different.
Maybe, I don't know. Any questions or concerns?
Anything else?
No.
All right, good.
General assistance? Done.
Meals on Wheels.
Meals on Wheels, senior nutrition.
39.
Okay, and you will see there's this budget. This budget has actually things have changed a little bit since I turned this in. In that I had taken the director position and made that half-time in this budget. I don't believe it's going to require half-time now. We have gone ahead and made the transition to mom's meals. And I was expecting that with that change that there would still be a need for about a half-time person. But as we got into the contract language and what they actually do, evidently they do a lot of what Jill has been doing. Jill was, the mom's meals will take her off the road, so we will no longer have to be on the road every day. We will, I expected that she might have to go every 2 weeks to help people get their meals put into the refrigerators and kind of coordinate with mom's meals. Well, when the mom's meals when they deliver their meals, for a 2-week period, their driver makes sure that they get that taken care of. So,
Oh, really?
yeah, so it will only be if, they end up delivering through UPS or something, but Jill tells me that sometimes the mom's meals truck was following hers. So, yeah, so, I don't expect that there will be that much interaction, as far as, being on the road even every 2 weeks. So what I think is going to probably happen is that position will not be very much time. It'll be intakes.
Okay.
It'll be, getting people onto the program. I'm understanding from, as we talk through the contract, that Mom's Meals will work directly with the MCOs, so that takes us out of the billing for Medicaid.
Oh, wow, okay, big deal.
People who we talked through the sliding fee, and how that works. And I believe how we landed was that if somebody has, falls on the sliding fee scale higher than what the cost of meal is for us, which is about $8.40, unless it's a special diet, then it might be a little more. But if they fall higher than that on the sliding fee, they may as well be a private customer of Mom's Meals and get us out of the middle of it. And so we're gonna work on making sure that happens. And
That's
so,
interesting.
so that will take us out of the middle of that. I will have Jill give people a call once in a while, just to make sure things are okay.
So can I ask you a question, Kim?
Sure.
Over the last, gosh, we've been changing senior nutrition for what, 5 years?
Yeah.
6 years, transitioning? I mean, just looking at the budget, we've gone from cut it in half, haven't we?
Yeah.
Probably
All of that, yeah.
More than that?
More than that,
Because
yeah.
I can remember it being 4, yeah,
Yeah.
400,000, clear back,
Yeah,
yeah.
it was probably just shade over 4 was the highest.
Yeah.
But the model that we're using right now, any way to document this so that other counties similarly situated could use it?
There's no reason others couldn't do this. I mean,
Because when you think about the cost,
Mhm.
you think about the service and the cost, you think about what we're doing in other areas of Marion County to try to still serve our population, be better, use taxpayer money better, and get services more direct to the people who need it. There's probably no better example than senior nutrition for what we've done with that over the last 6 years.
Yeah, it's interesting because since we let go of the contract with the AAA, that was kind of the trigger of finding new ways. And every AAA does it a little bit different. So if you go over to Milestones over Mahaska and South, they do it a little bit different than how Des Moines does it, how Aging Resources does it. But if a county, so some counties are on the hook financially more than others, depending on how their AAA operates. Right. But for us, by delinking from the AAA, I mean, this is, Mom's Meals it's an Iowa company. It's based out of Ankeny. It was started about 20 years ago in a kitchen in Nevada, Iowa, with a gal that was just trying to solve a problem for her mom. And so she did. And now it's multi-state. They do millions of meals a day. The meals in Iowa come out of either Des Moines or Grinnell. And so I don't know why another county that wanted to, like if they thought they were putting too much money into it, if there would be no reason why they couldn't look at this same kind of model and
Right.
see what it does for them, because this will be really good.
Yeah.
And Mom's Meals is already in place, and I mean, they serve every county in Iowa already.
Right.
And mostly they use them mostly for Medicaid. Because they're overseen by dietitians, they meet all those requirements, and they can be delivered in very rural areas.
Mhm.
So that's the one issue that I need to have clarification from you guys, whether, right now, we only serve, in the incorporated areas of the county. And with this change, that would be something that you might wanna consider opening up to the more rural areas, so outside of, incorporated areas.
What would that,
Because we don't have to do the travel every day.
cost-wise, what would that do?
Well, I figured this budget on 10,000 meals. And that was before I found out that Medicaid would be taken off of our plate, and that we would take the people who are on the sliding fee scale above that, take them out of the equation, because they'd be private.
Right.
They would be private, so we'll just make referrals for those.
Mhm.
So I think we could probably do it for the same budget.
Yeah, I don't see why we wouldn't do that, Kim.
Yeah.
And add the unincorporated area. I mean, the intent of senior nutrition and the changes were to get meals to people who needed it, no matter where they were in the county.
Right.
And if the incorporated areas, the cities in particular, had services available, Knoxville, Pella and such, they should utilize those services. And then we'll use the resources to get to those other areas that have more need and less availability. So I think that would still fit with the intent of what we're doing. So I would definitely start looking into seeing how we could do that as well.
Okay.
Especially if there's no budgetary impact. That just seems to be, that is the intent of the program.
Yeah, to serve the people, yeah.
Okay, well, we'll work on that after we get all the transition over. Our last hot meal delivery is next Wednesday. And so Monday, they don't deliver on Mondays, people should start getting their box of meals on Tuesday and Wednesday of next week. So they should have them by Thursday before hot meals quit.
Mm-hmm. And we did test the meals.
Yep.
Here at 3014. I thought it was very good.
Yep.
Yeah. So
Yeah.
I'm very impressed.
Yeah, people seem to like them.
Mm-hmm.
The folks that we kind of fished around and asked folks who already have had them, and they seem very happy with them. If you look on the website, they have like a 98 or 99% rating of, yeah.
Satisfaction.
Yeah.
So what do we do with the vehicle? Where's that? And then what do we do with Jill's time then?
Well, I'm going to move Jill over into a position that is grant funded.
Okay.
And so she will have a soft landing. She will have plenty of work to do, and just in a different capacity. And I've already talked with her, and she's good with that. The vehicle, I don't know, give it to environmental health.
There you go.
I was say, can you take the box off? Does the box work something? Because
I was gonna say, isn't it? Yeah, it's the food
Yeah,
truck, right?
Yeah. No, I was
I
being
could ask
facetious.
Bridget what she could store back there. I guess.
I was being facetious. I think maybe I should ask.
Maybe Cameron could sit back there.
Well, if we're gonna ask a staff member what they could store back there, we probably should ask the medical examiner group.
Oh, that's cold.
I know.
Oh, I'm sorry.
Sorry.
Bridget says.
I can transport animals in it.
No, I would suggest that we try to find somebody to buy it.
Okay.
Okay.
That would be the best. Yeah, that was cold, sorry.
Kim, is it safe to assume that in our restructuring process, on the revenue side, on the revenue sheets, that we're showing up with some negative numbers as far as revenue, like donations and things like that?
I
I don't want to assume that, I'm just
Yeah.
thinking.
Yeah, well, first, We are definitely serving the people who don't have money. I mean, on that sliding fee scale. But there are some that need to be paying $1 or $2 per meal. And one thing that we have discovered is that our billing was not quite on track with a few things, it was behind, so we're getting caught up on that, so. But we really do serve some very low income people, and that just aren't gonna pay. But I think that the structure that we have is about as responsible as we can get as far as.
This is never gonna generate or cover its costs with revenue.
No,
So,
no. Especially if we are referring people who would pay more than what the meal costs us, on to work directly with Mom's Meals.
Right.
So we will only be taking care of people who need, assistance with that sliding fee.
Okay, so just so I'm clear on it, like I'm looking at contributions from Pella, so that's based on individuals, not the city of Pella.
Correct.
Okay.
Those are the individuals
Okay.
that are sliding fee.
Okay. Now that makes it clear then.
Yeah, no, those are not, that's not
Okay.
revenue from the city of Pellet, no.
Okay.
all right, very good.
All right.
Any other questions on general assistance? I love the direction, Kim. I think you've done a tremendous job restructuring this program. And we're serving the people who need to be served.
Yeah, I
And
can't
we're
think,
tying the dollars that we expend to that service, which is where this should have been years ago.
I can't thank you enough, Kim, when you took this on to get this where it needs to be. I mean, we struggled with that, we did.
So, and it makes me think, since we're talking about senior nutrition and like the Travis Trust, I know the Travis Trust is supposed to be used for those, they're in, this was it city of Knoxville or the corporate of Knoxville?
For the benefit of the
Knoxville.
Yeah, benefit of the
So
citizens.
over 65.
Yeah, over 65, yep.
That's what it says.
I mean, is Kim, just thinking out loud, is that something that possibly, let's say some, all the extra cash that's floating, that's helping people now, do we hang on to that and then help them in the future in this area in Knoxville? Or is there something that we need to be looking at and doing with this Travis Trust now?
I would need to revisit what that trust says and look at it and just have a conversation with you folks
It wouldn't.
We've
looked at it for
years. It's been
years.
years. It's been years since I've even looked at it.
Yeah,
So
I do know it's Knoxville.
The problem is it's centered on Knoxville,
Yeah,
the city of Knoxville.
That's the problem.
So, and we've had this discussion probably for 5 years on how we could utilize the funds. And what I've been waiting for is for the city to come up with a plan for their seniors. And we have this discussion periodically, what are you going to do for your seniors? So that we can use the cash, because it just sits there and loses value. Michaela can't invest it. So it's been sitting there for over 30 years.
It's been a
or
long
longer.
time.
No, it's gotta be almost 40 years since Bill Travis put that in there.
Maybe in the
80s.
development of the VA property, there might be some discussions and plans that they could.
Well, I think the call, and we'll refresh this with the city of Knoxville again. What are your plans for seniors? Because it's very specific on what it can be used for. We were going to, remember, actually offer this up to Knoxville Senior Nutrition when we restructured. Our condition was what? We had to see their books. And they wouldn't open their books.
Right.
Because as the trustee, we can't just give cash and not have any visibility to that. So anybody we give that cash to, there is going to be a financial audit of that organization. There has to be, to conform to the terms of the
I think
trust.
we give them 10,000 to help sustain them, but yeah, we can't give them.
So that's what's going to happen with that, but we do need to refresh that, but I don't think that's that's in your wheelhouse.
Thank you.
Unless
I don't think it is.
unless we wanted to defray, if you're doing any services in Knoxville, and we defray a certain component of that service in Knoxville, that would be about the only way that I think we could make it fit, and I'd want to talk to Ed before we did it.
Well, in
just to
senior
get it.
nutrition, the agreement was that the Knoxville Senior Center would take care of
Yeah.
the city of Knoxville, so we really don't do anything
Yeah,
in Knoxville.
City proper,
I mean,
yeah.
we would, if somebody came to us and wanted a referral to Mom's Meals, we would hook them up, that would be fine.
Yeah,
But they, you know, kind of the original agreement was they'll take care of Knoxville and we'll take care of the rest of the county.
right.
and, you know, Mark's right, Keisha, we really had that discussion, we really.
Yep, I remember talking a lot about it.
We
you know.
tore that thing apart, and it's pretty specific on what it's to be used for.
Very good. Any other questions on general assistance?
I don't.
All right, very good. Kim, public health.
Public health, this is not the easy one. And it's the one that is actually mine.
What number? Oh, there it is.
So it's number 23,
Yep.
health board. And again, we did the 3% bucket. And you will see that this budget looks a lot different than the current year's budget. We are in we are in competitive year for maternal child health, for WIC, for First Five, most of our largest grants.
Did your microphone get turned on?
There we go. Am I back?
You are back.
Okay. All right, so we are in competitive year for most of our very largest grants that we have to serve families. And so in a year like this, normally what would happen is that we would compete and we would design our service area. This competitive cycle, the state designated the counties and the geographic area, and it's very, very different from what we currently serve. So you will see that this budget is built on what it would look like if we receive all of the grants that we compete for in this new cycle. So I wanted to make sure that there was space in the budget to move that money through.
Right, so right now, total budget, you have no county ask in your numbers.
That is
That's right.
true, and that is contingent upon if we get all of the grants that we request.
Okay.
So-
And that we compete for.
So let's talk macro here first. Like, I think when you talked about this in the, was it public health board meeting? I can't remember.
Yeah, probably.
So I think what we would need as a board, Kim, because the question is, what's the certainty of getting all those grants, right? Jake and I have been looking at Fund 1 numbers and just getting a read on the impact if you got nothing with Fund
Right.
1. So we take down everything correspondingly. We're still good in Fund 1, just in terms of the impact to the fund, because you take your expenses down, you take your revenues down correspondingly. But I think from a public health standpoint, if you don't get it, what will you need to shore up? Because there'll be certain things, if you don't get that, you may not need anything from the county. You just don't have the service,
Correct,
right?
correct.
And you don't have the staff for it because they're
Right.
tied to the grant.
Correct.
So that's a zero sum for the county, but there may be other services that we need to serve Marion County residents that are tied to the grant, that if we don't get it, then we have to fill that gap somehow.
Correct. If we did not get any of these things that are tied to this competitive year, we would probably have maybe 5 people in the health department, 5, maybe 6. And everybody else would have to leave because or we would have to make agreements with the new contractor for what can we do for Marion County, and they would have to pay us accordingly. So it gets really muddy.
Sure, but I want you to speak to the reason you approached it this way. It's not just a flyer and you're throwing darts at a board saying, I think we'll get 3.9 million on these grants, and if we don't get this, the probabilities are 50-50 that we end up with 5 people in the public health department.
No.
It's not that.
Oh, no.
So give us some context
Okay.
to why did you
Why
approach
did I
it
come up with
this way?
these numbers?
Yes,
Okay, so what I did was because the geographic area is so different and the makeup of the counties is so different. I went back to 2017 which was the last competitive year. And I looked at their numbers for each county for the allocation. And that's what I used to base this on. So it's the money based on 2017 per county. That's the only place that we could find where they had it broken down per county. And because at that time, we picked and chose which counties we were gonna be in the service area. So that was the only place we had to start. So we went back there, looked at those numbers, plugged those numbers in, and built what this budget would look like from those numbers.
Okay.
Does that make sense?
yep. So that's your baseline
Correct,
for arriving at the total dollar value
right,
of each of the contracts
right.
associated with the budget.
Mhm.
What about, why would Marion County Public Health get these contracts?
Why would we want them, or why
Why
would
would we get,
why
well,
would we get them?
we're applying for them,
We're applying for
so I
them.
assume we want them,
We do.
okay? So why
There's-
would we get them? What's the,
Yeah, what's
to
the-
get
well-
3.9 million of these contracts with a 2017 baseline?
We are already a provider of those services, so we've got the experience to do it. We have the staff who knows how to carry it out. We know how to manage them. And why we want them is because we want to control the services in Marion County. Because if we don't control those grants, we don't control what services are in Marion County, and we get what we get.
Okay.
And we have one competitor that we know of.
Put the mic
Uh,
on.
Is it green?
It's red. Should it
Maybe
be
the
red?
batteries are out.
Yeah, you wanna go to the mic and I'll try to get it. Sorry. I'll try to
Okay.
get it.
Technical difficulties.
Okay. So we have one competitor that is experienced that we know of, and that will be American Home Finding out of Ottumwa. They are a private nonprofit, and they, and so we will be competing for this. I believe they will compete hard, we will too.
Is there a time in which they're presented and then you can go back in and negotiate, or is it just pick and choose? I mean, cause
It's
and the competitive, I'm assuming in this world, you would get to pick or choose,
pick or choose what?
meaning like, if there's two bids in front of you, whether it's, Marion County or this.
We compete, we will write the grant, they will write the grant, and whoever scores the best gets the
It's like a
grant.
rubric, like a,
Yep.
yep, okay.
So there's a rubric, there's a scoring mechanism, and if they score better than we do, that's a bad day.
Yeah, so there's no going back.
So
No,
nose go, yeah, that's
No.
it, yeah.
no, it's, yeah, and that's how it always has been.
So where's the
but it was
competitive?
just different then.
So so if it's a scorecard framework
Mhm.
based on the grant writing, what are the key, there's gotta be key drivers to the scorecard, right?
Right,
What are the key drivers? I don't
Those
know
are-
anything about, so what's the key
for each one of
top
them,
4 drivers to the scorecard?
well,
That'll determine whether you get it or not.
every grant has that rubric that says how they're scored. So financials are scored, the work plan is scored, there are different key factors in all of them. But based on the service that you are competing for. And so, but financial is always one.
And the administrative rate.
When you
The
say
administrative
when you
rate.
say financial, what do you mean by that?
The administrative rate, whether they understand your costing,
Your cost structure.
and one of the that's something that we have to explain very clearly in the applications,
Because the nonprofit,
because the nonprofit will get their federal cost agreement with, and have that blessed with the feds, and they automatically get full points.
yeah, they get to double
If
dip.
we get
Feds and
somebody,
state.
if we get somebody who doesn't understand the financial stuff and doesn't understand the cost reporting mechanisms, doesn't understand, if we can't make it really clear, then, or they just, that's just not their thing, that they just don't understand. It's common for us to score less than full points on that, and it can be just because they don't understand the financial piece, the grant reader. Some of it boils down to the grant reader.
So understanding the financials, cost structure, and understanding cost structures, complicated, especially when you're up against a nonprofit that can get federal support as well.
Right.
Well,
they get,
it's a whole nother, I'm gonna get on my soapbox here in a minute.
where
do we win? Where do we win?
Where do we win?
Yeah, if
It's
cost
our
structure's,
expertise,
if
yeah.
cost structure's
We
tough,
win on our expertise and our service delivery plan.
okay,
That's where we win, is the service delivery plan.
and what's the weighting? Are they equally weighted? Does it depend on the grant reader?
I think it depends on the grant,
Okay,
yeah. Those scoring mechanisms, they're outlined in every grant application or every RFP. And so what we'll do is we're meeting with our partners in this. So we are meeting with our public health agencies in this new service area and talking with them about what can you do for serving your own county. And so what our intent is to build a good, strong public health infrastructure for the entire region where we manage the grant, they carry out the service. There will be some things that we have to do. They're not gonna hire a dental hygienist. We're gonna have to do that. They're probably not gonna hire a dietitian. We'll do that. But as far as having an office in that county for WIC, we're gonna try really hard to get every public health on board for doing that. Having an office having a staff member that is fluent in First Five and can make those connections and help us to meet those requirements in that grant. So part of this isn't just service delivery.
it's compliance and administrative.
And we would be compliance and administration for the service area, but part of it also is trying to develop a good public health infrastructure in this new service area.
Why?
Yeah, what's the benefit of?
Why are we doing, why are we going in this direction?
Why are we going this direction? Because individually, the small public healths, they don't have enough there are public healths that have 2 employees. So there's no real public health infrastructure for them to serve, and that's part of what we have going on in our current service area, why we couldn't get them to come along with us to provide the service in their county. And that made us have to drive all over the place.
Yeah,
So if we can build that structure in those other public healths and help support them financially for some of their staff through these grants and use it as pass-through money, then it builds them up and it helps us when they can provide service for themselves.
Right, you reduce complexity for the
Correct.
smaller public health areas. They're just providing services.
Right.
You take care of all the complex back office stuff.
Correct.
Overly simplistic here,
Yep.
but that's what you're doing. But what's the public policy rationale for this? Because that's really, in order to kind of look into the crystal ball and say, this is directionally where I see public health going. What's driving that thought, Kim? Because you're responding to something you're seeing in the broader context of public health.
It's a
within the state.
regionalization of public health.
Yeah, okay.
But it's a regionalization of public health, but my view of that is that regionalization of public health does not mean that Marion County Public Health should drive to Timbuktu every day.
Right.
That's what
'Cause
we're
that's
doing
what it's
right
been,
now.
yeah.
And that is not in the best interest of us, and it's not in the best interest of the citizens in Timbuktu.
Sure.
I mean, there should be a public health, there should be a landing place in every county where they can go, where citizens can go and get their public health needs met, just like what we're doing here.
So with all of this grant and all this dependent on grants, what's our current, our relationship with IDPH? Because there'll be a key driver to this.
IDPH provides the grant dollars through contracts.
But what's our relationship? How do they like us?
Oh, yeah, for the most part. For the most part, we have a good reputation with IDPH as far as our administrative capabilities, and they know that if something goes crosswise, I'm just gonna call them and say, hey, we hit a bump in the road and we're fixing it or whatever. But they have a good level of respect for Marion County. They know that we want to do things right and that we want to serve our people. And they have traditionally, when the feds show up at the state and want some place to showcase, they bring them here. They've done that in preparedness before. They've brought them down. They brought the CDC down. They brought HHS down to meet with us before.
Mhm.
So that tells me that they have a good respect for us. Now, every place, IDPH has their silos, and every silo is a little bit different.
Sure.
But overall, I think they have a good respect for us.
Okay.
But when you're talking about competitive grants, that doesn't matter. What matters is the scoring.
Yeah.
We have to score well.
I find it kind of troubling that a public health agency has to compete with a private nonprofit.
I don't know, it's the way it is.
I know it's the way it is, but
I mean, you're right, because it disfavors the public health
Yeah.
agency. So you create something with state dollars, you create a system with state taxpayer money, and then you allow nonprofit
you
entities to
open it
come
up.
in, and they get federal assistance that we don't get, and say, oh, here, by the way, you can compete with those folks. How does that work, really?
It doesn't make much sense. I mean,
Yeah, but we will, I am hoping that it will come through very clearly in our applications that we are working towards building a public health structure for Iowa. And frankly, I would like this to be the example as far as what works.
no, I don't disagree with what you're saying, Kim, at all. It makes sense.
And it, to a certain degree, dovetails with what we're doing on the mental health side.
Correct.
There's definitely linkages there, and we've
Sure.
talked about those. So there is, and we've had the discussions from a legislative standpoint. We just had our meeting last Thursday,
Mhm.
and we'll have another one coming up here next week, I think.
So it's Thursday, isn't it?
Hopefully, yeah.
Yeah.
Waiting to hear from DHS.
Okay.
Okay.
Yeah.
You mean tomorrow? Next week.
Thursday.
Next
Next
Yeah,
Thursday,
sorry, the
okay.
10th.
Okay.
You threw me off there.
Yeah.
But yeah, there seems to be some receptivity to the idea of creating a structure that is future forward,
Mhm.
but anticipating also, as Senator Edler said, where the state's going.
Correct.
The state is thinking about these things as well, so we are, to a certain degree, we're in alignment
Right.
with the direction administratively and legislatively that they're thinking about. So that's a good thing for where they want to take this.
Yeah, and the state is, they're aligning DHS and IDPH in certain areas. They're merging the two. And we don't know quite what that's going to look like, but our vision of our service area is kind of the same vision that they have, as in there is one entity in every county, but if there's a need, that's where the citizen goes to. So
So
that's what
what's
we're
the-
trying to help build.
So what's the risk, Ken? We talked about this a little bit. We don't get 20% of the grants. We don't get 50% of the grants. It's competitive.
Mhm.
There's gotta be a certain baseline we feel pretty confident about. We're gonna get X.
I'm confident.
Otherwise you wouldn't put in the budget.
That's right. I wouldn't have put it there if I didn't think we were gonna get it.
Yeah, but there is a risk factor,
Absolutely.
as you articulated.
Yeah.
What is
So,
that?
do we need to have in our minds a contingency of some amount that you may come back and say, look, we didn't get grant 1, 2, or 3, and we still want to provide the service in Marion County, that's gonna take this much money, or decide whether we want to do the service or not.
So you can see that our current, my current request from the county is, I think will come out about even.
Yeah.
If we don't get any of it, I would say we would probably need 400,000 maybe to support the pieces that we have to do.
Okay. Good. No, that's what that's a top end number.
I think so.
Okay.
Yeah.
And you've done this,
Yeah,
have
that's
enough
what you-
experience in it, you know.
I think in the past you've talked about that too, being roughly that number, that between 4 to
Well, that's what we used to
5.
get years ago.
Yeah.
Before we trimmed it down.
Yeah, the more big grants that we get, we will take, we used to be pretty wishy-washy about taking our administrative percent. We're not wishy-washy about that anymore. We take our administrative percentage. And
Yeah.
it's, and we can, we've been told that we can pretty much take 10% of those grant amounts, pretty much without question.
Mhm.
I know that the first application that came out said that we can take up to 15%. So we'll have to talk about that and what that looks like, because
Sure.
we really do want to make sure that we can provide the service, but we're not gonna take anything less than 10.
Good.
I have a couple
Is that fair?
questions.
Yeah, that's fair. And we'd have to support the 15%
Right,
if we voted to that.
yeah, so then if we have to support the 15, then there's no room then we have to be able to prove it in an audit.
Right.
Whereas at 10%, there's really no question, is that, yeah.
Right.
And some of this is not obviously with you guys, but in some of the federal dollars that are received, not by us, but in other agencies and nonprofit, is it 20%?
It depends on if they have an indirect cost rate.
Okay.
So if they have an indirect cost rate,
Oops, here. Sorry.
it could be up to 20% or higher.
Okay, that's what I wondered, because
Yeah.
I've seen some of those nonprofits.
Yeah.
Kim, can you help explain to me that you said the 2017 was the last competitive year, and when you say using those were baseline numbers in 2017 timeframe to today, are you looking at those figures? Or are you looking at are we looking at inflation? I mean, I don't understand when you say
I'm
just
looking
20.
at purely the dollars that were allocated.
Okay, all right.
So, and the dollars that were allocated and the counties that we competed for. So we, in 2017, we were south and west. And so the population of those counties are 5,000,
Right.
7,000. When now our service area goes south and east, and it includes Atumwa.
Yeah.
And so the numbers are
Is that a
significantly different.
Region that has been redone by Iowa,
IDP.
yeah.
Mhm.
Okay, all right.
Yeah, they did, I do kind of appreciate this. They drew the lines and said, this is the service area.
Okay.
Instead of having this choose your own counties, which is nice in some ways, but that means that every 5 years, all the work that you've done in the previous 5 years to build relationships and build infrastructure in those counties gets blown up. And it just gets blown up, and there's all kinds of ugly games that go on, because of the competitive nature. So they drew the lines and said, these are counties that you're going to, compete for. So it doesn't eliminate the games, but it certainly decreases them.
And then we've talked about in the past the benefit of having the region here.
Mhm.
Is that number still that 35% back to the citizens of Marion County, or is there's a quantified number, I thought, meaning beneficial to having these services here?
The benefit to having the administrative piece of it here is that we control the services for Marion County. And I'll just pick on American
Yeah, give me an
Home Fighting
example,
because they're the most likely competitor for us. If they
Say that again. What were you saying?
they're the most likely competitor.
Which one though? I didn't hear what you said.
So I'm gonna pick on them for a minute, but
I know, but who? I didn't hear.
American Home Fighting.
American Home.
Because
Okay.
they're our competitor that we know of. And so if they are awarded, they will say, well, we're gonna provide this number of services in this county and this number, and they can say, we're gonna come to Marion County once a month or twice a month for WIC. Well, we do a lot more WIC services here.
There's two benefits.
Yeah.
We control the service.
Yeah.
And you don't spend $400,000.
Correct.
That's it. There's your benefit.
Yeah.
We control that service, and our residents take advantage of these contracts.
Right.
And the fees, so we're taking that off of our taxpayer.
Mhm.
So those are good things.
Yeah.
Why do some of these counties not want to do it?
They don't have the infrastructure, and they don't have the experience. They don't have the supports of the boards, because their boards don't understand, because they don't understand the ins and outs of how to do it. There's a lot of the public health are they don't have any kind of business background, and they don't understand how this works. And frankly, they have gotten smaller and smaller and smaller over the course of the years because they are dependent on one little grant here or one little grant there. Some of these guys only get, maybe $15,000 from the state total.
Wow.
Total. And then everything else is paid for through their board of supervisors. And so it's so they there gets to be a certain point where you're just drowning and you just quit.
Well, I think you hit the nail on the head though, Kim. I mean, if we're doing or potentially doing compliance administration, the compliance aspects of this and the financial aspects of this have only gotten more complex.
Right.
So if you do not have that expertise in county,
Mhm.
it's not fair to ask people who are not in those areas
Right.
to sit there and administer this stuff. It's not
Right.
possible to do
Yeah.
that because you don't have that level of complexity. Just in the time you and I have done this together, which has been 10 years, has probably gone up by a factor of 3. That doesn't bode well for local control.
No, it
At all.
doesn't. No, not at all. And public health historically has been run by nurses. And nurses aren't business people.
Right.
They're nurses. They're all about putting their hands on people and taking care of people. Otherwise, they wouldn't have gone to school to be a nurse.
Right.
And so nurses are being put in, or have been historically put in the administrative role. And it's not their forte. It's just, some of them do very well. Most of them, it's just beyond what they can see, because it's not their thing.
Yep.
They want to take care of people.
That's good. Very good.
So
Well, I'm interested. I hope we get it all.
I do.
This would be, now I'm gonna say this, if you do get it all, and you don't need any county money, you have beaten Steve Edwards.
Ha, take that, Steve Edwards.
I see Steve is on.
I do too, I wouldn't have said
So
it.
Steve, you've got a limited amount of time
Up your game.
kind of challenge Kim and get to where you cover all your costs, so.
That's just hurtful, Mark.
It's all good natured fun, Steve. It's all good natured fun.
When do you find out, Kim?
Every piece of the, of this, the application is released and the notification dates are all different.
Okay.
So it'll start, I think we start finding out in, I wanna say it's the end of April, and then it just kind of trickles through the July. Some of these are state fiscal year, some of them are federal fiscal year.
So from a general fund standpoint, Jake, 400,000 isn't going to put a dent in our,
So correct. I mean, that's why you have fund balance for situations that would come up like this. And it wouldn't all be general fund because a lot of that, I'm
Is it-
assuming it's just employee costs. which
is it
would
like a
have-
70-30 split?
It would have FICA person benefit and health insurance as well. So it would be actually split between fund one and fund two.
Okay,
There's all the other stuff, taking care of the building and all things like that that is outside of that budget anyway. So that wouldn't be a change.
sure, okay, good.
So that is I never wanna say $400,000 isn't a lot, but, that's why you have fund balance. And then the budget would be fine because it's at an expense of this level.
Right, so they're gonna be, it'll be done
The budget,
corresponding,
from a budget standpoint, it's fine, it's a cash flow.
right,
thing.
cash flow issue,
And you
okay,
can see what your projected cash flow balances were, it should cover it for a year until you figure out what's happening.
very good. Right,
There's a lot of moving parts to this, so I will come back and update you as things progress.
all right, we appreciate that.
There's a lot of things in the air.
Well, I appreciate it, and I appreciate all the work you put into this, you and your team.
Yeah, they're good.
They are good, they're very good. So, Steve, Keisha, any other questions for Kim?
No,
Okay.
that was interesting.
So last one,
Okay,
Kim,
last
medical
one.
examiner.
Yes.
This is interesting, yeah.
This is interesting, and, and you know what, I just realized I made these copies and then
28.
failed to give them to you. This is,
Is that that letter?
this is the
That letter you sent with,
the letter.
I think that should be in the.
That's in here.
book.
Yeah.
Did you get this? I've made a couple of revisions.
Okay.
Got it? Oh, yeah, pass it out.
Alrighty, and kind of how this came to be was the medical examiner group came to me and said, you know, we just feel like we need more structure. Things are getting done and, but we just don't, it just feels like things are everywhere. And I think it's just, they were looking for just some additional structure.
Mhm.
I don't know what else to call it. And so as we sat and talked, they really don't have, they have their policies for how they do things in the field and how they do their medical examiner work. But the business piece of it, there's no structure, and everybody was just kind of all over the place a little bit, and you know, I don't know how, and I haven't talked to Jake about this, so I don't know how you feel about it, but it sounds, from what I'm understanding, it sounds like somebody decides they're gonna send a bill to Jake, and they send a bill to Jake. And he had no way of knowing, is this something that should be paid, is this not something, so he may have to dig or whatever to find out what is right and what is not, legit. And it was, things are legit, it's just that the structure was missing. So what they came to me and asked me for was structure. And so I've given you a draft procedure for how the money flows, how it works. And when we initially talked about this, I talked briefly with Mark about it, and he was like, "Is this about money?" And I said, "I don't think so." But as the further we got into it, the more it was like, yeah, there is a component of that.
There's no money.
They've not had an increase since 2011. The investigators have been doing their work for $200 per event since 2011. And so you'll see in the draft procedure that we would increase that to $250 per event worked. So the other thing that they asked for was the payment for the medical examiner and deputy medical examiner to be paid in, let's see, separating out the deputy medical examiners would be $7,500 per physician appointed, and we have 2 of those. And then mileage and receipts are required for expenses paid. I don't know whether they ever turn in expenses. I don't know. It sounded to me like things were kind of loose that way. And
Which area are you talking
the,
Which group do you mean for turning expenses?
the medical examiner and deputy medical examiners and the
Deputy medic,
investigators.
yeah, the MEIs were generally just a flat fee,
Yeah.
and then the medical examiner reviews, the $75 or whatever. They never, to my knowledge, they didn't turn in mileage and stuff like that, it's just
Yeah.
$50 or
And-
$75
Yeah.
on a
And the-
list.
Yeah, and the code, we kind of dug into the code. The code says that we'll pay or the county would pay expenses in addition to that. And so this just kind of sets things up to work alongside the code and to create more of a structure where that bills would be sent in more standardized. Is that, I don't know.
If you're looking
Yeah, I'm
for
looking at you.
a blessing from the auditor's office, you have full blessing from the auditor's office. I mean, yeah, it's just a MEI claim comes in, the medical examiner would write down names for a while and turn in, and they signed off. There was documentation that someone passed or they did that review, but we have no issue with,
Yeah.
sure, it might be a little bit more, I mean, because you would get like all the autopsy bills and all that, would eventually, you would get routed probably directly to the county and then out through you guys to go through. And I know there's some plans to be able to coordinate all the steps along those processes, because if it's from an out-of-county person, you can possibly ask for reimbursement, but there's so many stages that invoices can come in on one death over a year period. So,
Yeah.
we have no problem with the structure and someone turning in a clean claim with the COA on who we're paying with all their provided documentation for their claims is fantastic. It's not a problem with us.
Yeah, so kind of the approach that we would take, and this is what I told them, if we would do it, and this would be blessed, we would do it just like what we do for all the other programs. It would just become handled, like the financial flow would be just like every other program where if something is ordered, it has to be signed off on. If something is, if there's a purchase, it's gotta be signed off on. If everything, there are the checks and balances of our financial process.
Yeah,
And
there's
then-
not many supplies and stuff other than body
Body
bags.
bags, and I think.
And there's
quite a few of
technology's been entered into in the last couple of years that I think's been very beneficial to those the
Yeah.
MEIs and stuff out there that is new. So, yeah,
Yeah.
those would have to go through that anyway. Generally, historically, it was just autopsy fees,
those.
the review from the medical examiner, and then occasional transportation fees. So there will have to be a learning curve if there needs to be a pre-approval. because
Right.
So can I,
Oftentimes the
Well,
event is over.
No, I understand
And
that,
so,
but for purchasing and that
Oh,
kind of
yeah.
stuff, and,
yeah,
but like body transports, there's not gonna be a pre-approval for that, but
no,
it
the
will
question that comes down to
standardize
that
it though.
is the reimbursement for those
so,
That will
costs.
standardize that.
That's
Yeah,
where there's
so
gonna be a curve.
so the operations of it and how that all works and flows and let you guys work all that out. And as far as what it costs to do this job, I'm not gonna debate that. But what we've done is, so we've shifted money out of what we pay the medical examiner to the deputies, to give them the 17,000. We take 17,000 out of the medical examiner, we shift it to the deputies, and then we add these MEIs, this 22.5. Am I
So-
understanding that correctly?
Yeah, all three of those positions have been in the mix before. It's just that they were separated out differently.
Okay, so
And it's an additional, there's more money in the request for this year.
okay, so when I'm looking at this spreadsheet and I've got, what am I missing then?
So the medical examiner, would be $8,500. We could put, the deputies are 17,000.
Mhm.
And then 22,250 for the MEIs.
Yeah,
And
so,
those are based on the number of investigations that they're doing. And when I talked with them, the number of investigations has gone up significantly over the past couple of years.
okay, so you're saying that last year we had these people in the budget?
We, last year, well, the deputy medical examiner, did we have two before?
It was a single line item. It was most generally anything that went to an MEI.
Well, we've got one more MEI than what we had because we added Tracy.
And say, how many do we
And
have?
we
Yeah,
have, so we
Three
have
or
the
four?
medical examiner, which is,
Dr.
Dr.
McKeever.
McKeever, thank you.
But isn't there assistant then, Lebsing's underneath him? Is there?
Lensing and Eartham
Okay,
are deputy medical examiners.
okay, so hang on, Lebsing's.
So they were per diem?
Mhm.
Okay,
It
so
was
they're
all-
the
it was all per diem.
17,000.
It
That
was
the
all
thing.
per diem?
It was
Per diem.
all, so like the deputies didn't sign off on very much. It was generally McKeever would sign off
Okay,
on the reviews and then MEIs.
but
That
the
was
per
generally-
diem did not equate to 17,000,
No.
or do we know?
So, sorry, I'm looking, basically what we had were the two line items. So if you look at medical examiner
Mhm.
at what was budgeted at 25,000 and then autopsies ended up being at 50, that's what we had. And I think what you're getting to, Mark, is can you divided,
I split
what
them
was
out.
that 75 into those three line items effectively? Correct.
Okay,
Is I think what we're trying to get to,
Right,
right?
yep,
okay,
yeah.
okay, I just wanted to understand where, if we were shifting dollars, just taking what we had and dividing it differently.
So,
So it
So
was
we've
that, sorry, but if like if you take up those, there's more money, so it was just two line items coming out of, for the medical examiner, that was kind of, and then the MEIs were kind of the other, autopsies and medical examiner.
So what was last year, Jake, for
It
this?
looks like that
Next
portion of
sheet,
it was
yeah.
75, is the current year, when you say last year.
Yep.
It's hard for me to remember what year.
Yeah, sorry, budget 22.
Yeah, budget 22 is 75.
Okay.
And you can see, if you look over how much was actually used in 21 and 20. And if I'm saying something wrong here, let me know.
So we're doubling it.
I have, so
there's a-
yeah,
it's a lot, I mean,
Yeah,
it's
that's
it's
what I
a
wanna
lot
make sure
more.
I wanna make sure I
There's
understand.
there's
more.
more money in here because of it's
So more people,
it's more people and then the quarterly
And then
payments or
the-
whatever and the increase rates.
Right, you're adding the ME,
Yeah.
the 22,000.
So it's dividing it up a little bit on who's actually doing the service, I believe is what, and then there's additional money here. It is, I can't believe how much they go out.
yeah, they go out a lot.
The MEIs go out a lot.
It's really, yeah, and
So-
so I separated them out and actually on my cheat sheet, I should just give you my cheat sheet.
Well, that's what I thought I was looking at,
yeah, that's what we're looking
but I've
at.
got blanks here.
Do you have,
And so I'm trying to go to the cheat sheet
You
and,
want me to run copies of stuff?
oh, okay, so
Yeah, we have that.
you have this, okay.
yeah.
Oh,
So what
okay,
I'm trying to do is, see Kim, I've got 8,500, 25, 17, 22. So there's a reduction in
right,
the ME, you take the 17, now we're shifting that down to these
Correct.
folks.
yep,
So
And then
there's
you
three
add
of
in the
them.
22.5,
correct, because
Which-
these are based on number of, yeah,
yeah, so if I had 75,000 last year,
yeah,
I add in 22, now I'll just round up and say I'm at 100. And so now you got 49 or 50,000 of additional work,
mhm,
right?
Yep.
Somewhere, body transport, It looks like your autopsies have gone up, a new line item of 10,000.
Yep.
There's your difference.
Yeah, there we go.
Okay.
Okay.
I got it, thank you.
Okay, sorry about that. Yeah.
So
So,
it's, do we wanna increase pay?
mhm.
Do we wanna pay the MEIs?
Yeah.
Whatever, however they're paid, and how that's,
200 versus
how that's broken
250.
out.
250.
Well, and
yeah.
I don't care about the quarterly or whatever, it's the gross amount.
The other thing that we built into this, and it's not really a budgetary thing as much as it is a process thing, is that they've created, do you remember how we were keeping track of COVID, our COVID numbers on
Yes.
this magic spreadsheet?
Yes.
So we created a magic spreadsheet for deaths in Marion
Oh,
County
okay.
that will help us to have better data about what the cause of death is.
Is that where we
And
got our suicide rate numbers?
yes, that's how we're going to get those numbers.
Okay,
So it helps us to, because that spreadsheet is kind of looped into the procedures of payment,
yes,
so that we have better information about the deaths in Marion County that require an ME. And which will give us information on suicide rate, on,
so it ties back to our public health services,
correct,
potentially.
correct.
Yeah.
And the prevention stuff that we should be doing on the other side, but we don't have the data to know how to do it.
Right,
So it will help us to do that.
yeah, okay, good. Well, if something hasn't been updated since 2011, is that the last?
Yeah, that was what I'm understanding, that was their last time they had to pay. I don't know if that was the first time they were
It's been,
paid,
I
or
don't even,
whether
I
that
don't
was,
know.
they said that it's been
this
that
rate
way
for a
since
really long
2011.
time.
And I know
it's just-
talking to Terry, they do go out a lot.
They go out
They
a
do.
lot.
They go out a lot.
The MEIs
The MEIs do, yes.
Yes.
go out
Yes.
a lot.
So I don't have,
All times of
I don't have
day.
an issue with updating this, Kim, to make it current for the current environment. I do like the data portion. That's the part when Terry brought those numbers forward, I was shocked.
Yeah.
At what we're seeing in Marion County, and we
Yeah.
don't have any visibility to that because we never collected it.
Yeah.
Or at least not in a way we could use it for anything.
Right.
So that's important.
I have a question for you, Kim.
Mhm.
So typically there's been the medical examiner and then the deputy, and now we have 3. Is that common? And do you have any idea? I don't even know. I mean, I didn't know if that, for other counties, do they typically have
It's
the,
different everywhere. I think they told me it was Mahaska that had all of, that there are like all their ER docs maybe, are deputies. I don't know.
wow, that'd be a
it's
lot
a-
for them to,
Well,
Yeah,
just
I
from
don't
what
know
I see from
exactly how this works
some
other places.
basic questions through the affiliate base camp stuff, Mahaska County is a county hospital.
Yep.
So that helps them at
Oh,
least
yeah.
get, people that need to be their MI. We had
oh,
historically
I
here,
hadn't
we've
thought
had
about
every
that, yeah.
doctor listed as a deputy so they can sign off on the MEI's reviews or whatever. It's not the easiest thing to get people to want to do or do.
could it be a cost savings though? I mean, if they
Please.
were willing to do that? To me, I mean, we wouldn't necessarily still have to have them. We could have one maybe,
I think there's a training component that has to be,
Well, we have to make sure, are you talking about, because medical examiner versus medical examiner investigator have different qualifications?
yeah, no, I'm talking about a medical examiner actually being the doctor,
The
yeah.
doctor. So, would it say what?
So, because we don't have a county hospital, we have the 2
Mhm.
hospitals, getting them, I guess, in the past, I mean, I think sometimes we're, unique in that aspect, and being in rural. Just wondering, the savings if you were to get those, whether it was Knoxville or Pella to have.
I think it might be, I'm not sure if the
Because when
charges would
McKeever
be
was-
less or not, because the amount of deaths is the amount of deaths. I think part of the problem, Keisha, in the past has been, people just don't wanna do it. They don't wanna take the time,
To do.
and they don't wanna have to do the review or sign off on it, because then there's potential trial cases, liability, those types of things.
So when McKeever was practicing here in Knoxville, did he do that encompass just, and we didn't pay him extra? Do we have any?
He kept a list, and whenever medical examiner investigator report that went across his desk, it was $75.
Okay, just separate, okay.
Yeah, we used to just cut him a check.
It would be in your claims.
Yeah.
He didn't turn them in regularly.
Okay. Just interesting to know,
Yeah.
okay.
It was just a flat rate. So like on this budget, it's a bigger number, and some of it, if there goes to some sort of a guaranteed pay, for lack of a better term, and that's probably the wrong term, but quarterly allocation for them saying yes, or those types of things, and then on top of the fee for service, this is one where if it's not needed, it won't get used, because it's literally based off the occasion.
Right.
Occasion based.
It's
So
usage, yeah.
it's not like, right, you never know, because historically, we haven't changed this budget a whole lot, but we have had to amend a few times.
Yep.
Just
No,
to true it up at the
And
end
that's a
of the year.
good point, Jay. That's a very good point.
Now, if there's a guaranteed allotment, then that's guaranteed.
Right.
And it's been a bit active, you know.
So did we pay out then the medical examiner, because we had that line item for 25,000, I guess I can look here.
And so,
Yeah,
Keisha,
past
not to
23.
be confusing, but just because it said medical examiner doesn't mean that was all to like Dr. McKee.
Oh, okay,
Yeah.
all right.
Because you didn't have a segment.
It was
You
just,
okay.
Yep.
Yeah.
Okay.
No.
Well, I think there's no doubt that it needs some structure.
I'll admit that.
And the medical examiners themselves, not the investigators, but the examiner, they're on board with this.
Yeah.
Good.
Yeah, Dr. Lansing and Dr. Eartham, thank you, have been more involved. I mean, Dr. McKeever has been somewhat involved in these discussions, but they have been more involved. And the investigators have been very involved with that. We've been having, there have been monthly meetings for the last, I don't know, probably 4 months or so.
Working this out. I know,
Discussing and
and
working
Terry has
this
done
out
an
and,
excellent job
yeah,
shepherding some of this too.
yeah.
Isn't she kind of leading
She's
the
an
charge?
investigator too, yeah.
She's the one that brought it to me. She and
Yeah.
Dr. Eartham are the ones that brought it to me. And this is all, she has a role at the health department and in preparedness and working with EMS. So this is all separate
Right,
from
this is her.
that. This
Yeah.
is,
Yeah.
so we will, as we work through this, she needs to be the one that kind of checks it off, because she knows what is actually happening.
Yep.
But yet the administrative stuff will fall to me, because I'll be the final sign
Okay,
off.
I was gonna ask you that, yeah.
For it.
Because she is one of the investigators,
Because
yeah.
she's one of the investigators, and she needs to make sure that we keep our two hats separate.
Yep.
And so this stuff has to be separate time from health department time.
Yep.
Correct.
Very good. Any other questions for Kim on this?
And you're comfortable with taking that on?
Yeah, it's
Okay.
just another program.
Okay.
All right. Very good. Kim, Lindsay, thank you.
Thank you.
Thank you.
Anything else?
Nope, I think that's it.
Okay.
You're ahead of schedule by now.
Cool.
Wow.
We've got
All right.
gift time.
Let's take a 5-minute recess and then we'll
I didn't know if you were gonna wanna come back or.
organize the rest of our time, and maybe we're done, or maybe we'll have some discussion, but I need to take a recess. Is there a
Thank you.
motion?
So moved.
A second.
Sorry, I've got mental. So recess. Ramey,
Aye.
Johnner,
Aye.
McCombs,
Aye.
Very good.
Cool.
If
We are recording.
All right, is there a motion to reconvene?
Make motion, we reconvene.
Second?
Johnner,
Aye.
McCombs,
Aye?
Ramey,
Aye. All right, we're back in session. Thank you, Kim.
You bet.
Very good. Lot to digest there. No pun on the senior nutrition component of that. Do we have anything we want to talk about now? Anything from a scheduling standpoint? Tomorrow, we have, I don't have the schedule right here in front of me. There we go.
No, that was.
There we go. I got it now. At least I thought I did.
it's basically 9 o'clock for you guys, and then there's a department scheduled in the afternoon.
So in the morning, yeah, we're working on our list, I
So we
believe.
got health insurance. Oh yeah, so in the morning, 9 to noon is to go through this list. And then lunch, and then Michaela and Tyler and Steve. Thank you. So is there anything we want to discuss now? Anything on your minds you want to talk, or do you want to wait till tomorrow?
Good with waiting
We
till
got a big
tomorrow.
list to tackle tomorrow, so. Everything from fund, anything we want to do on the fund side, sales tax, lost, levy rates, comp board, staff raises, lots of big stuff. Oh, I'm sorry, someone's gonna message you. All right, if there, nothing? Steve, you good?
No, I'm good.
All right, very good. Is there a motion to adjourn?
Make motion, we adjourn.
Second?
McCombs,
Aye?
Ramey,
Aye,
Johnner.
Aye.
very good. We'll see you tomorrow.